Well, good afternoon, everyone. It is right around the top of the hour. We'll give everyone about a minute or so to filter into the room before we are underway. So glad you could join us today. In the meantime, jump into the chat, introduce yourself, let us know who you are and where you're watching from, and I'll even make sure the chat works. Let's see here. We may be having some trouble with the chat, so I'll try to get that resolved as we go, but in the meantime, let's go ahead and kick into our conversation. It is so good to have you all with us today. My name is Dan Worry. I am the Senior Director of Early Learning at the Hunt Institute in Cary, North Carolina. We are an education policy support to the nation's governors and state lawmakers, primarily founded in 2001 by Jim Hunt, who was the four-term governor of North Carolina. The Institute supports education policy all across the continuum from prenatal through post-secondary, but once a month we pull together on our early efforts webinar to focus on the earliest part of that continuum, the years of early childhood. And we are so excited today to have a fantastic panel to talk about the child care crisis. If you are, unless you've been living under a rock, you know that we are having probably a number of interconnected crises in child care in this country. It has received a great deal of media attention, but today we're hoping to get past the description of the crisis and really dig in on some feasible solutions on a bipartisan basis to the child care crisis. So that is our plan for the hour. I am thrilled to welcome our panelists today. Marika Cox-Mitchell is the Vice President for Early Childhood at the Bainham Family Foundation. Elliot Haspel, many of you are familiar with. Elliot is the author of the book Crawling Behind, America's Child Care Crisis and How to Fix It. And Elliot serves as the Director of Climate and Young Children at Capita. And Cheryl Oldham is the Vice President of Education Policy at the U.S. Chamber of Commerce Foundation. Panelists, thank you for being here, and we're looking forward to digging in on our conversation today. But before we do that, I am thrilled today that we are offering this program as part of a partnership with Early Learning Nation. And so I want to bring my dear friend and colleague Linda Shockley into the conversation to offer a few comments and words of welcome. Linda, we're glad you could join us.
I'm thrilled to be here, Dan. Always look forward to any collaboration and work with you and the Hunt Institution. I've timed this to 90 seconds, so everyone can time me too.
All right, get your stopwatches.
Just a few words on Early Learning Nation, in case the attendees don't know. Early Learning Nation is an independent publication. It's focused on early learning, 0 to 5. We cover the science of the developing brain, new policy, and challenges and successes in the field. This is all original content written by stellar journalists, the very top voices in the field of early learning, policy, economics, and general features, including interviews and book reviews. We are meeting the moment. By independent publishing, I mean that we're not part of the corporate for-profit media. This is important as newspapers and magazines, both corporate and independent, are shuttering at an alarming rate, even before the pandemic. And for those that remain, education and early learning beats have been eliminated. We've lost community journalism, local journalism, and that's been replaced by news deserts and paywalls. We're covering the early learning beat, available 24/7, and it's free for all. I'll add that we are very fortunate that Early Learning Nation magazine is an initiative of the Bezos Family Foundation. This ensures our editorial independence. No one is telling us what to cover, even suggesting what to cover. It also means that we don't have to continuously fundraise just to pay our writers. We are fortunate indeed. We'll just add a few links to the chat in case you want to check out our free Substack offering, our free monthly newsletter, and our social pages. And I hope you'll tune into us and follow us and share us. Thank you.
Linda, thank you. And I want to apologize, Linda, to you and to everyone. It seems our chat is having a problem today. It is not something that I appear to be able to enable right now. So we will we'll continue on, but apologize that the chat isn't working as it usually would. A couple of housekeeping items as we get started. One is that we will be taking your questions a little bit later in the hour. And we will ask that you use the Q&A function, which I see is working, to have people tell me that the chat is not working, down at the bottom of the screen. If you will use the Q&A function during the next hour to pose questions that you'd like to ask the panel, a little bit later in the hour, I will call through those and we'll try to ask some of your questions. As always, the Early Efforts web series is closed captioned as well. If that's a service that would be helpful to you, you can find the closed captioning controls down at the bottom of your screen on the Zoom toolbar. We are always asked whether there will be a recording of this session. There will be a recording, and generally you'll find that there always is. These webinars end up on the Hunt Institute's YouTube page, generally within a day or two after the original live broadcast. So all you need to do is go to YouTube, enter Hunt Institute into the search bar there, and you will find this session and many others for you to take advantage of. And so invite you to pull that up as well. So with that, why don't we jump into our conversation? Panelists, I have to tell you, I've been really looking forward to this conversation. Three of my favorite people and some of the smartest people I know in this field. Marika, let's jump into the childcare crisis. And I mentioned early on that we really want to spend the hour focused on the solutions potentially to the crisis. But I thought it would be worth taking just a minute or two up front to help frame what it is we're talking about, maybe for anyone who is watching that hasn't been as familiar. So what are the challenges right now that is facing the childcare industry, and why is it apt to call it a field in crisis?
Sure, it's a pleasure being here to have this conversation. First, I think it's important to acknowledge that the childcare crisis is a human-made crisis. We essentially have an outdated childcare system that is poorly designed. It doesn't meet the needs of families and young children. It is also a failed business model that negatively impacts the practice and well-being of early childhood professionals. This childcare system is broken because it is designed based on many flawed and biased assumptions. It assumes that young children, infants included, are not learners and humans with individual rights. It assumes that supporting child growth and development is easy, that it does not require significant emotional, physical, or intellectual labor. And hopefully the pandemic has sort of squashed that assumption. It assumes that parents and white mothers in particular should be their child's full-time caregivers and not be a part of the out-of-home labor market. It assumes that the responsibility of raising a child is not a societal task. It assumes that childcare support should only be provided under extreme cases like a war, a labor shortage, or a health pandemic. It assumes that childcare support is solely an intervention for those kids, and certainly not all young children. It assumes that early childhood educators must be overly regulated to do their jobs well. As you can see from all of these baked assumptions, they're rooted in racial, economic, and gender biases. And as a result, we have a system, no surprising, that's unfair, it is ineffective, and grossly underfunded. It works well for no one, not young children, not families, not early childhood education professionals. But I think it's also important to note, like all broken system, there are industries that profit off the brokenness, but that's a whole nother webinar. We can chat about that another time.
Marika, thank you. That definitely lays out just a few of the challenges, and boy, are they some challenges. So we'll circle back to you in a minute, but I want to bring Elliot into the conversation. Elliot, literally, you have written the book on this topic, Crawling Behind. So share with us a little bit of your thinking about how we go about solving this, particularly right now in this sort of divided political atmosphere.
Yeah, thanks, Dan, and thanks again. It's great to be here. I appreciate the opportunity. I think it'd be remiss not to start by saying, the true solution, I think most of us know this, is a fully funded, pluralistic, public-private system that simultaneously makes childcare affordable, ideally free for families, pays educators, families sustaining wages, ensures strong quality across the board. And that vision is going to take an investment of tens of billions of dollars a year in permanent money flowing. Anything short of that isn't a true solution, but as you say, we have divided government. The reality is what it is. And so the steps we take in the meantime can either move us closer or further away from that vision. So that's something important, I think, is that incremental steps are fine, but you can take incremental steps down the wrong path and actually get further away from where you want to go, or you can take incremental steps towards where you need to go. So I do have three sort of specific things I think we can think about doing in this moment. First, we have got to start getting educator wages up. Very little else matters if we don't do that, because there's no supply in that case to meet the demand that we're creating. And I'm not talking about moving educators from like $14 an hour to like $16 an hour. I'm talking about, $45,000, $50,000 plus with benefits. And we are seeing many states start to invest more and more money into childcare. We're seeing some investments at the federal level, but frankly, most of these are skimping on wages. Wages are not as nearly as much getting as much investment as affordability. And in my mind, that's foolish. And there are various ways you can do that. You can institute wage scales. So if you will look at Colorado, had an early childhood compensation and benefits task force that proposed some wage scales. Vermont commissioned RAND to do a report, and they proposed a wage scale. You can utilize in states that have wage boards, something called sectoral bargaining, which is basically a kind of a collective bargaining of the entire sector. That's been successful in other industries. And you can tap tax revenues to create permanent wage supplements. Like, these are ways we can start to really deal with the compensation issue, even as we wait for those big investments. The second thing I'd say is we should take a good hard look at regulations and infrastructure. I will never say the childcare crisis is being caused by overregulation. It's not. And I want to say explicitly, I'm not talking about ratios here, but there are real barriers to progress when it becomes unnecessarily difficult to start a childcare program because some licensing requirements are unhelpful, and there's zoning issues. This is an acute issue for our family childcare providers. And some states are starting to act by easing zoning restrictions. They're not letting landlords discriminate against family childcare homes anymore. There's an article, I know we can't post right now, but if you Google EdSource on family childcare laws, there was an article just today or yesterday about what states are doing around that. And then there's infrastructure within the actual state systems themselves. We saw a lot of states struggle to get ARPA money out the door, and it was not for a lack of effort. You've long neglected state infrastructure when it comes to data collection, communication. How do you transfer money? Like, these very nuts and bolts implementation things. And we can be working on that. That's all going to need to be in place whenever we do get the money we need. And the last thing I'll say briefly is, this is the time to figure out how we get friends, family, neighbor caregivers into the mix. How do we get school-age childcare into the mix? How do we get stay-at-home parents into the mix? Any sort of next generation childcare policy is going to have to broaden the focus from just formal programs, just where a lot of our policy sort of attention goes these days. And I think we're actually working against ourselves in some ways by focusing too narrowly on those programs. So broadening that constituency is going to be good for families and kids, and it's going to be good for the movement. And that can practically look like get those groups to the table, right? Like make sure that when you're having conversations about what a policy should look like, whether at the local, state, or federal level, you want to have FFN there, you want to have stay-at-home parents there, you want to have the school-age childcare folks there. What are the actual mechanisms? Do we think about stipends for stay-at-home parents or for relative caregivers? Do we think about making sure that these new benefits are extending up through elementary school? These are real live questions, which we should be asking now as we get ready for our next kind of run at the big actions when the political kind of window reopens.
Elliot, thank you. And we'll revisit all of those topics here as the hour goes on. But I want to bring Cheryl into the conversation. Cheryl, the impact of lack of affordable and accessible childcare across the country certainly is a challenge for parents, but we know it is also a challenge for employers. And so, curious to hear kind of your perspective from the U.S. Chamber of Commerce Foundation, and in particular, what are you hearing from the business community on this topic of late?
Yeah, thanks, Dan, and thanks for inviting me to be a part of this conversation and to be here with Marika and Elliot. I appreciate everything that they've said thus far. I should say at the top, the foundation's mission, the Chamber Foundation's mission is to harness the power of business to solve big problems here in the US and around the world. And so we consider this to be one of them. And that's not to say that the business community should solve this alone. But you're right. We kind of got into this business maybe around 2017. And it was, speaking to, sort of drawing on something Elliot said about sort of expanding the conversation. Back then, not that it was that long ago, but the primary conversation, at least in this town, was around universal pre-K. And that was the thing that was dominating most of the conversations then. And so when we got into it, we really wanted to think about it from this 2-generation workforce issue, the idea that parents need work supports in order to show up and feel good about their job and feel good about where their child is and be, productive workers and to do what they want to do in the workforce. And then, of course, certainly quality childcare is so essential to the next generation and laying that important educational foundation. And then, of course, the pandemic hit and we have seen these, massive labor market shortages. So we're at about 3.5 million more jobs than we have people in the labor market searching. And that has come way down from where it had been. I think we're in, 5.5 million, 6 million over the last, couple years. And so, we've surveyed employers, we've heard things like around 2/3 will say that childcare is an issue for why they are seeing employees leave or not be able to return post the pandemic. And so we started to really look into this issue of what is it costing employers? What is it costing state economies? And we have done some research in about a dozen or so states, and it really ranges anything from several $100 million annually when childcare breaks down to as much as $9 billion annually in a state like Texas, when there is not access to quality, affordable childcare for working parents. And so we hear it all day, every day. And I should say, and it's from businesses of all sizes. And again, it's not to say that they want to solve this problem alone, but they do see a role for them to play, certainly in support of their working parents and what can they do. And they're not in the childcare business necessarily. And so it's our job, or we see it as our job at the Chamber Foundation to then support those that are trying to add value here and present solutions, and what are the sort of the menu of solutions that the business community can provide to support the working parents. And I'm happy to get into some of those at the right time.
Yeah. Why don't we circle back to that in just a minute? But Marika, you were so good as to kind of kick us off with this introduction to the crisis, but I want to hear from you as well, your thoughts on the solutions. You've had a chance to hear a little bit from Cheryl and Elliot so far. What would you add in terms of how we move forward here?
Yeah, absolutely ditto to everything that Elliot and Cheryl said. Regarding the cost, I think it's also important. Of course, I'll be the one on mute. Certainly ditto to everything that Cheryl and Elliot said. Regarding the cost, I will also just add that who determines the costs and what are the non-negotiables are also important. Early childhood professionals and families should drive those cost calculations. In addition, I'll add that solutions must normalize quality, meeting industry standards. Like in every other industry, it's not a luxury or gold standard or 5-star. It is an expectation and a fully funded expectation, which is the intersection between cost and quality. And regarding options, I think families are looking for meaningful options and a combination of meaningful options that include both a trusted caregiver or family member and a competent early childhood educator. I think Elliot touched on this earlier. I think in this need to find solutions, it is important to label solutions appropriately. There are solutions that are transformative, which frankly, I think that's what educators and families and administrators are looking for. And there are solutions that are helping families and professionals just navigate the current crisis. And helping to navigate the current crisis is noble work. It is important work, but that's not solving the crisis and that's not transformation. So I think as we have conversations about solutions, it's important to just label them appropriately. Is this transforming the system, even if it's incremental, or is just simply to help folks navigate the current system, which means the crisis remains in place?
That's really helpful. I want to remind our viewers that unfortunately the chat is not functioning today, but if you have questions for the panel, invite you to drop them down into the Q&A, and we'll get to those in just a couple of minutes. You know, Elliot, we were talking about sort of the bounce back, if you will, of the American workforce, right? During the pandemic, we saw, you know, a very sharp decline in employment rates, you know, kind of a historic drop in that. But we know that we have sort of, inched our way back up, actually, to a place that we're a little above where we were in March of 2020. The same isn't true of the childcare industry, though, is it? Talk a little bit about sort of where childcare finds itself in terms of its workforce.
Yeah, so this is interesting phenomenon where, you know, if you look at the labor force participation of mothers of young children, they've bounced back, they're higher than they were before the pandemic. And you know, the St. Louis Fed just had a piece out the other day, some research again saying like doesn't actually, the correlation we would hypothesize between sort of the availability of childcare and labor force participation is not showing up in the data. And there are lots of theories around that, remote work. And I know there's research from sociologists, Jessica Calicaro and others saying, basically we're seeing women take this on and mothers as huge instability, right? Lots of part-time work, lots of relying on sort of, kind of cobbling together childcare arrangements. So not saying that everything's hunky-dory in the workforce, but we are seeing, there seems to be some sort of a decoupling of that issue. But the childcare workforce is still down 50,000 employees from what it was before the pandemic, which is about 5% of the workforce. And the reason seems to be that childcare programs cannot compete with other low-wage industries, right? This has been the problem all along, as we've cast childcare as a low-wage industry. So you're making $14 an hour, and the McDonald's employee is making $14 an hour, and so then you can compete. Now McDonald's employees are making $17, $18 an hour with some benefits, and the childcare program can't keep up. And that's, and what I've written about recently, though, is in my mind, our answer cannot be all we have to do is make childcare competitive with McDonald's again. Like if that's our bar, then we actually, again, to Marika's point, we're not solving anything. We're continuing to try to put band-aids on a gushing wound. So, the industry is struggling. That's causing all sorts of slot shortages. It's causing all sorts of cascading stress effects on the remaining employees. So we have to think about, again, what does it look like, what I said at the beginning, to get those wages and compensation and benefits up to family sustaining levels, to stop accepting the premise that childcare should be a low-wage industry. As Marika said, again, it's a lot of discrimination, there's a lot of racism, there's a lot of classism, there's a lot of sexism behind why that is. But the more that we go to our policymakers and we say, we just need to stabilize We just need to get back to where we were. Where we were wasn't working. And so that's my push, is that we try to find these solutions, again, things like wage scales, forcing functions that say, we're not just going to throw this out to the market, because the market is never, ever going to give childcare professionals the wages and benefits that they deserve.
And along with wages, I think it's important to add working conditions. So even in places where we're seeing increased wages, we're also seeing early childhood educators exercise agencies, and they're not willing to sacrifice their own well-being in the process. So I think as we think about solutions that certainly need to increase compensation, we also need to look at the working conditions of early childhood educators. To quote one of the early childhood educators, an infant toddler educator who we've worked with in some of our work, she said, and using her language, I don't need to be with anyone's babies before 9 and after 3 p.m. In that, she was saying, I can do the best practice. I am a trained early childhood educator. I can get to any outcomes with the young children I work with, but between 9 and 3, that's it. I can't do it after 3. And so I think we need to just also be innovative about the working conditions for early childhood professionals, because compensation by itself may not get us there.
Well, no question, it's an exhausting job. Anyone who has tried to take care of a single infant, for example, knows how challenging that is, much less multiple. Marika, I was going to ask you, though, you raised this question of the working conditions. I know the Bainham Family Foundation is doing some really interesting work in the DC area, really listening to providers. Tell us a little bit more about what that process looks like, and what are you learning?
Yeah, certainly. We've been convening early childhood educators, families, and administrators to learn more about not only their pain points in the current system, but what do they want to see in an ideal system. I think it's important to acknowledge, if you search childcare crisis, you'll have numerous hits. If you search childcare solutions, you might get a couple. We spent a lot of time naming the crisis, as we should, and I think we've done an amazing job as a collective doing that. We've spent fewer time asking educators, administrators, and families, so what should the solution be? Regardless of all the complexities of Build Back Better, I think it's important to acknowledge that in that moment, we didn't have solutions in a tight, coherent manner to drive some of those conversations. And certainly there are other factors as well. So in this We Vision Early Ed project, it's a very futuristic solutions-based project where we're asking, again, educators, administrators, and families, what do you want to see in this futuristic system, so that their vision of the future drives the reimagining. And that does not happen very often. It's often others' vision of the system that drives the reimagining. So it's putting the reimagining of the transformed childcare system in the hands of those who have the most proximity to the pain points of the current system.
Fantastic. Cheryl, I want to circle back to something that you said as well. You were talking about the nation's employers, and that they may not feel that it is single-handedly their responsibility to solve the crisis, but that a number of them are really beginning to step in more meaningfully. Talk a little bit about what you're seeing. What are the ways that employers right now are leaning in and trying to provide some relief for their employees?
Yeah, I think a great way to start an answer to your question, Dan, is to just level set a little bit about who we're talking about when we talk about employers who are not a monolith. And I think oftentimes we think about them and we think about the big ones. That's who we talk about in this town all the time. What is McDonald's doing? What is Google doing? What is Amazon doing? And all of those are important. But the vast majority of businesses have fewer than 100 employees. Actually, the vast majority have fewer than 20. And the most people work in these small to mid-sized companies. So I think when, it's been a bit of an evolution in the conversations that we've had in working both with employers directly, but state and local chambers all over the country. So, every community has a chamber, and these are, little, sometimes smaller, maybe sometimes not, than the U.S. Chamber, right? They're in their communities, they're leaders in their communities, they're trying to solve big problems and big challenges. And childcare has arisen as one of those key ones. And in working with them, I think what sometimes happens is people think if the business community is in the business of supporting their working parents, it needs to be with an on-site care facility. And that just isn't practical, isn't even viable for the vast majority of employers. So what we did is sort of put together a roadmap for the business community to really think very strategically about where can I step in? How can I support? If I'm a small business of 10 employees, if I'm a larger business of 100 or 200, what can I do? And one of the first things that we tell them is ask your working parents, what actually do you need and want? Because instead of jumping to a conclusion or jumping to a solution that you think your working parents need and want, you might be surprised at what they tell you. And it's been sort of interesting. We've had a couple very big companies come to us and say, okay, we want to provide a benefit. We want to do, X, Y, or Z. And I usually stop them and say, do you know what they need? Have you asked your employees first what it is you're looking for? Because parents are very clear. You're talking about their babies. They may not want to bring their kid and put them on an on-site facility. They might need assistance with a home care provider. They might need assistance finding childcare in their community. There's a host of things that employers can, and we see more and more often they will do, is provide some benefits in this space.
Elliot, I know you have been outspoken about this question of whether childcare should be an employer benefit. Talk a little bit about what you see as the dangers there.
Yeah, no, I appreciate that. And I think in my view, like obviously there is a role for employers here, but the question is the role to run childcare through the employer-employee relationship in some fashion or another, or to have employers contribute to a publicly funded system that benefits their employees through taxation. Like that is the fundamental question. And on things like public schools, fire departments, roads, these other, broad-based services, we almost always answer the question, it should be through taxation, not through an individualized benefit of some kind. And the one case, so a prominent case where we do it individualized, is just health insurance. And it's pretty well established that's not the best system, because you have issues of you lose your employment, you lose your health insurance, right? And so you don't want to set that situation up. I think the issue of on-site childcare, I'll put a quick aside. I actually think the on-site centers can be a good option for some parents. They can be part of a publicly funded system. There's no reason businesses themselves have to actually run them. So I think what I've written and what I've argued is the more we go down that road, the more we say we're going to incentivize employers, we're going to lift up employers, we're going to ask employers to be a part of the solution in a way that runs through the employer-employee relationship. We're saying this is an individual issue. It's an individual obligation for you to get as an employee. You're going to get it through your employer. And then we're just going to we're going to privatize it, basically. And that stands in contrast to making a higher argument that childcare is essential to family freedom. Families that don't work need childcare, right? So say parents, talk to them, like they need to have some access to childcare. We know that gig employees who have no formal attachment to employers need childcare, and it's essential to their functioning. They're thriving as to be able to have the number of kids they want, to be able to live in the places they want to live, to be able to invest in their communities. Like childcare is much, much more than just an enabler of parents to work. That's one of the things it does, but it's not the only thing it does. And the more we run it through the employers, the more that we reinforce the idea that that's all it is. And so I would like to see, I'll say the last thing, I would like to see employers continue to step up through taxation. And I think a great model for this is Vermont. So Vermont recently, as you all may know, passed a bill, $120 million a year in new money flowing, which is a lot for a state that does not have that many young kids. And they're primarily funding it through a small payroll tax. It's 0.44%. It is paid 75% by the employer, 25% by the employee. And they had lots of small business owners and other business owners come up during that debate and say, you know what, this is great. because I can make that money back really quickly in productivity, and it helps everyone, it helps my community. And that's the model I would like to see us pursue, as opposed to more of an individualized employer benefit model.
Yeah, I mean, the irony here is we're using childcare, right? If childcare is about the child, then labor participation is important, but not the primary focus. I mean, I'll argue fourth grade, third grade is about labor participation. Yet we decouple it. And so I think we have to be careful about the ideologies we reinforce when we intertwine labor participation and childcare.
The only thing I would say to that, I don't necessarily disagree with you, Marika. I would say what we have found, and I've heard this from early childhood advocates directly, who say tying it to workforce and talking about it as a workforce issue actually moves results. And so whether it's the right way to talk about it or the best way to talk about it, it's having some it's producing some results that I think we could all agree on and agree that we want to see. So if that's the way that it moves the needle of people who are in power that are going to help improve the system, I'm happy to talk about it that way.
It's a both and, right? I mean,
Yeah.
it'd be both and.
It is a both and, but I would also nuance, I suppose, that like it moves the needle a little bit, right? Like that economic argument has got, but it does, again, if it's just about the workforce, then why would we want the employees making more than the McDonald's employees? We don't need them making $50,000 in that case. We just need enough slots to cover enough folks. And this is, I think, the other challenge is that at some point, the transformative reforms that Mariko was talking about at the beginning are going to require a lot of money coming in, right? At the federal level, most likely tens of billions of dollars a year. It's the only way we do that. We spend $700 billion a year in this country on public education. We spend $500 billion on Medicaid, $500 billion on Medicare. Like these things that are significant public goods, the significant social goods require a lot of money. And at some point, that's going to mean having a hard conversation about taxes. And I don't think it's controversial to say that historically, the business community has not always been super fond of taxes that produce lots of new revenue. And again, respectfully, that the chamber was one of many business organizations that spent hundreds of thousands of dollars, putting up ads against the Build Back Better Act. So I worry again, like the more we rely on employers, are we actually setting ourselves on a path to the transformative investments, or are we just going to get to a point of treading water?
And just for clarification for folks who might not be totally aware of the history on Build Back Better, it was a very large bill. Childcare was a piece of it, and the chamber's positions on Build Back Better were much broader than this issue.
Oh, absolutely. I don't think that they were just about this issue. I do think there were $400 billion for early care and education in that bill, and there were, the chamber did put up ads against it. So I just think and again, this is my point. It's hard to square the circle, right? Like, and that's the more, so when I think about solutions, this is my great fear, because I'm seeing the trend in the past 12 months has been significantly in the way of saying, in an era of divided government, the solution has got to go through employers. We've seen this with the CHIPS Act the Biden administration put out. There was a New York Times editorial board member that said, like, let's make childcare a benefit that's available to every employee. Like, it's in the water. And so I'm really not trying to be like, or not trying to be obstinate. I'm respectfully trying to suggest that there is a real inflection point that we're at right now. And I think we need to think very hard about which direction we go.
The world in which I'm living in right now is employers, we're sort of living in the system that we have, at least for now, and until such time as we have a massive shift in how the system operates, I think the business community does want to be involved, and we're seeing them step up in ways that maybe they hadn't in the past, and in some cases will be forced to, right? If you're using the CHIPS example, but in many places it's because they are leaders in a community. It's not just a labor force issue for them individually, it's a broader community issue. You gave Vermont as example, Louisiana, Kentucky, Missouri, Michigan. There are a lot of examples of much more, significantly increased investment, and chambers and other business leaders are part of the community that's pushing for that.
Yeah. And I want to, oh, Marika, please jump in.
I mean, I think this also, first of all, the diversions conversation is great. I think it's a sign of growth. So I appreciate both Elliot and Cheryl, and also myself weighing into this issue of decoupling labor from childcare, the childcare crisis. I think this also speaks to the governance issue in childcare, like who does what, who speaks on behalf of families, who speaks on behalf of businesses, who speaks on behalf of early childhood educators is really important. And in early childhood, just given the work we've done in multiple states, everyone is talking, no one is including the voice and perspective of the early childhood education professionals, as well as families in some of these conversations. So as we figure out solution, it's really important to center those solutions on the specialized expertise of early childhood education professionals as well in these conversations.
I was going to say I want to jump into some of the audience Q&A in a second, but before we do, I just want to acknowledge. I mean, we're talking about the need for action, likely the need for action from Congress. Though as Elliot and Cheryl both referenced, there are states that are really stepping in and taking a lead in the interim here. How, in this polarized environment where it seems at times that Congress is challenged to unify on topics like this, how do we move this forward in the short term? It's one thing to say we need a publicly funded system, but that doesn't appear to be on the short-term horizon, at least in the next year or two. So what do we say to families, to employers right now who are facing this crisis, and what can we do to move this issue forward?
Are you asking at the federal level or just?
I am asking in general, but
Okay.
I mean, I think certainly at the federal level as well.
Sure. I mean, I would say, and we've been out there on this for a while, which is there are incremental things that I think and do enjoy bipartisan support. And so if we're willing to to do more of those things, like increased investment in CCDBG, some tax issues, right, that I think you've seen both Republicans and Democrats talk positively about, and they've shown interest in doing something. So if we can, I guess I would encourage, like, let's not make the perfect the enemy of the good, and let's bring together where there is bipartisanship and move some of those issues along. I think there is enough bipartisanship on a couple of those issues where we could see some action. Maybe I'm being Pollyanna.
No, I mean, I think I don't disagree, Cheryl. I think if you look at Tim Scott and Richard Burr, two Republican senators in the last Congress, they put out a proposal to reauthorize the child care development block grant, and it actually mirrored in a lot of ways many Democratic priorities. It said you'd have free care if it was under 75% of state median income. It said that you'd be programs would be compensated enough to be able to pay their educators well. Lots of stuff that the other side would agree with. That the difference, there was no money attached to it, so that's always where the rub is. Again, like, comes back to money. But I do think, and that I got 14 Republican co-sponsors, which it was the last Congress, but like that's filibuster proof, right? So I think philosophically the parties aren't as far apart, at least in the Senate. This particular house is its own can of worms that we don't need to spend a lot of time getting into, but I'll note that Ro Khanna on the Democratic side, Nancy Mace on the Republican side, they started like a caucus. There is another bipartisan caucus, so there's some chance there. For me, though, this is where the federal level, this is time to spend laying groundwork again, figuring out questions of what about the next time we do have a political window open, what's going to be able to pass. What were the things that really didn't work at Build Back Better that we might be able to find compromise on? What are the things that the other Republicans really care about, the Democrats would be fine with, right? What are the things the Democrats really care about, the Republicans would be fine with? Is there some sort of bargain? That kind of work can happen behind the scenes, even if nothing's going to pass. We should be probably on, and major is going to pass in the next, however many months before the 2024 election. But this is where the state, I think, and locals come in, right? This is what I was saying at the very beginning. Like, we can work on fixing regulation right now. We can work on figuring out how we get FFN care and stay-at-home parents into the system right now. We can figure out how we reform the way that data is collected, so we actually know how many providers we have and where they are right now. We can start figuring out wage supplements right now. So all of that can happen. And the last thing I'll say right now is the childcare cliff, the end of the rescue plan money is coming. And I think there is a chance to continue to push for stabilization grants. And many states on both sides of the aisle have done a pretty good job of saying, okay, we're gonna fill in to at least, again, keep things from falling even further. So I do think in the short term we have some opportunities, but I also think we really need to start laying the groundwork for what comes in 2025. Like, that work starts now.
I would just add one thing to what Elliot was saying about sort of at the state and local level, which I 100% agree with. There's no point in sort of banging our head against this wall for too long. I mean, there's certainly things we can do, and we should. But we're going into our second year now of a project with the Bipartisan Policy Center, where we are working now in, 13 states, with the business community, along with state administrators and ECE advocates, to really look at, okay, what are the sort of the biggest challenges we have in state X, and how can we come together to try to fix those, whether it's policy, whether it's programmatically, how do we, and so I think, every state's going to have, its different set of challenges and a different set of solutions. And I think that, we've seen this in workforce, we've seen this in K-12. The business community can be a helpful advocate. And when they get involved in things that seem a little bit, I guess, unusual for them, and that's usually how it looks when it's in places that deal with little children or education, for example, their voice can be powerful. And so that's what we're harnessing in this project.
I think that's right. The 30 seconds. I think one of my favorite models for this is actually here in Colorado, where I live, EPIC, or Executives Partnering Communities. And what they do, in addition to the other work of thinking about their employees, they bring executives together to advocate for the big state changes, right, for the big policy changes. And so that absolutely, we need business community to step up and say, yes, like, this is gonna take money. This is gonna take significant transformative investments to make it happen.
Ruth has a question in the chat, Marika, that I thought would be a great one, maybe for you to weigh in a little bit on. We've talked about the role of the business community. We've talked about, the role that Congress might play, that states are playing. She's asking, what's the role that philanthropy plays in helping to advance this conversation?
Absolutely. I think philanthropy can fund policy and advocacy. Both C3 and C4 organizations will be important to pave the way to the inevitable transformation. I too am an optimist, Cheryl. I think the transformation is inevitable. We're not as far away as we may feel at times. I think philanthropy can start seeding solutions right now. In our work with We Vision Early Ed, listening to educators, administrators, and families, we're like, let's bring some of their solutions to life right now. What would it look like if childcare was more universal and affordable? What would it look like to have an accountability system that is less burdensome and provides autonomy for practice? What is the true cost of quality, right? I think we can certainly start paving the way to that transformation, supporting the advocacy it requires, creating clarity and coherence that's necessary. I think that's one part we often overlook. While we can all advocate for the childcare crisis, when you start going into the weeds and the nuances, a lot of incoherence, even among early childhood advocates. So getting that level of clarity and coherence among advocates is really important. And like I said, just like piloting and elevating solutions, I think philanthropy has an important role to play in all of that.
I think they can do what Elliot just suggested, which is the work needs to be happening now for what could come later. And philanthropy was a huge resource for us in the civil rights community, the business and civil rights community coming together to advocate for K through 12 education reform, and where we saw synergies, we worked together, and they helped to, sort of make that work possible, and to really build that kind of grassroots network of advocates and people who believe together the same thing. So that, I think, is, that's what we need.
We saw that firsthand in Washington, D.C. with the D.C. Pay Equity Fund, healthcare for childcare. Thanks for bigging up and including Vermont. We saw that in Vermont with the support we provided there as well. So absolutely, philanthropy has a role.
Couple of questions in the chat about on-site childcare, and we talked a little bit about that earlier. I don't know that there is a single answer. Is there an appropriate role, and maybe what are the limitations to on-site childcare offered by employers?
I
You should
mean,
start, Cheryl.
where it exists, I don't think anybody would argue with it, right? I mean, we've told the stories of, businesses who have established on-site care in their, and the employees, they love it. So I certainly would never want to suggest it be removed for places where it can be helpful. I think there are, I just think it's going to be such a small, it's going to reach so few employees. Ultimately, it's not going to be, the answer, I think.
Yeah, I think that's right. I mean, I mentioned this on our prep call, right? I saw an article, the Pittsburgh airport's putting in childcare. That makes total sense to me, right? You, the airport employees, great. But as we, Cheryl's totally right about the limitations. And just to reiterate what I said, there's no reason the employer has to be the one operating that facility, has to be the one funding that facility. They can outsource, and normally they do outsource it to another or an organization, but it can be part of a publicly funded system where, it's part of a quality system. It's part of, this. There doesn't need to be a significant difference between the on-site center at an airport and the center down the road, or the family childcare providers.
And I think we have to stop thinking about the settings. I think most of our policies are about the settings, right? We exoticize the space it happens. And I think while we're doing decoupling, we also need to couple like where the practice occur. It is important and to some degrees irrelevant, right? Many professionals practice in many spaces and receive competitive wages. And I think in our childcare, we have to start decoupling those two. We spend a lot of time talking about the setting of the practice versus the practice itself and what families need.
I think what families need is a really important piece that you just ended on.
Interesting question in the chat as well about sort of the messaging around this. We talked earlier in the hour about how in many states, many conservative states in particular, the workforce messaging around the importance of childcare has been a very successful message in a lot of ways. If that's not the message, and we recognize that that's maybe part of the message, but not all of the message. Question is, what is the ideal messaging around this?
Yeah, the first thing, anytime you're talking messaging, right, is messaging goes to audience. So you're going to say a different message to a different audience. But broadly speaking, my argument is like we start childcare, your early care and education from a place of this supports family freedom and well-being and child family and well-being, right? This is about children having and families being able to flourish, being able to develop in a way that the parents can, again, I always try to get this back these days to the most American value, right? Self-determination. There are many, many families right now who are saying, I have to move from this place that I love, from this faith community that I love, from this neighborhood that I love, from the school that I love, because not because I want to, because I need to get closer to someone who can provide, childcare. For you families that are saying, I want to have another kid, but I can't because I don't know what I'm going to do about childcare. Like, where those arguments are not arguments we've been making. It's different than a child development argument, like school readiness. That's true. That's one piece of it. It's different than a work enabler argument, which is true, but this is different. This is foundational to American families being able to be the cornerstone society that we say that they are. And I think we have to really, if you think about the arguments for public schools throughout the years, almost none of them say, to what Marika said, that like the second grade lets you go to work, right? Like it's not like the parent goes to work. It is one of the things school does, but the arguments for schools are much higher in their ideals. They're much more about having a competitive, globally strong America, about having strong families, having strong communities. Like, we have to get to like that level. And that wraps everyone in it. And this is the last thing I'll say on this, is I think this is why I get concerned sometimes when we still kind of chop up our benefits for childcare by like income and like saying we're going to help like low income families, but we don't want to help high, like things like, if we're saying this is truly a social good, this is truly a public good, then it needs to be something that everyone can access. It needs to be part of the communal fabric of this country, which is the way many other countries handle this, right? Their kids started with paid leave, and then they go on into having public options, or they can choose to stay home and get public support to stay home with their kids. I think that's the kind of vision we need to be able to communicate, rather than this program, this subsidy, this setting, to Marika's point.
Exactly. All families need childcare supports to thrive, and they want a range of accessible options.
I recognize we're getting close to the top of the hour. Our time is winding down. There's a question in the chat that I think might be a good one to close us out. Maybe I'll let each of you weigh in. Marika, it was posed to you, so maybe I'll let you take it first. The question was, Marika, what is the first step we need to take to encourage transformative change of our child care system? If you could advise policymakers and those viewing right now, what's the first step in moving this in a better direction?
Yeah, I'll say unpack the mindsets. Like what is the, I mean, it sounds hokey and highly conceptual, but it's really important, right? Because the mindset you use to define the problem and drive solutions impact the policies you're going to advocate for, right? Is it about liberal participation? Is it about families thriving? How you answer that question produces two different policies with two different price points. Are early childhood educators part of the education profession and require competence, specialized competence to be effective, and compensation? How you answer that question impacts the price point and the policy. So I think we should just like pause for a second and unpack all of these mental models, because the mental models determine and drive the funding amount as well as the policies we advocate for. And I think at times we don't do that because those mental models are so invisible and implicit, but I think it's really important because they determine everything: the price point, the policies, compensation, access, options for families. So I'll say let's start with the mental models and really spend time unpacking those.
Cheryl, let me let you weigh in on that same question. If we want transformative change for childcare, where do we begin?
I think I'll say we need to begin where we are, which is we have to be realistic about what is possible now. And that's not to like be to dodge a transformative change question, but I do think we need to do the work now. When we started doing this work, I think my kid was in kindergarten. He starts high school next week. I mean, if I were waiting for some situation to change, like, we gotta work on these issues now. And so that's, I think, what we're doing, and in communities with bringing all those stakeholders together and really working on addressing the challenges, at a sort of state by state level, while we continue to push at the federal level.
Cheryl, thank you. I'll give you the last word on that question.
Well, thank you. And thank you to my fellow panelists. This has been great conversation. I think iron sharpens iron. So I appreciate being able to talk to people, in a respectful way, even if we don't agree on all the counts. I think my answer is probably a corollary to Marika's, which is we have to change the way we talk about childcare. We have to have policy that matches that. I think the vision that we have, the way that we communicate about why we need an effective childcare system and what that will mean, it does. The way we have talked about it in the past 20 years is different than what we talked about it 20 years before. And now we're in a moment, right? The conversation has shifted. The paradigm is shifting. We had a window, we didn't quite get through it, but we're still in a very different place than we were 5 years ago. And so if we think about every conversation we're bringing in, like what is the message that we're bringing in? I actually think one of the first steps, and this is something I'm working on at Capita, is like thinking about, the future of childcare and how do you literally go on a campaign to change people's minds about it? We have lots of thoughts about what we think it's about. You can do ad campaigns about that, right? You can do local things. You can put up billboards. You can talk to your folks in your community. You can start on the granular level and in more organized ways to change those mindsets. The mindsets that we're going to need. And I think that would be the first step, because again, that doesn't have to wait. Like politics happens in windows. There's going to be another time, sometime where the federal or Congress and the presidency lines up in a certain way and there's a window for something big. But we can also like both soften the ground and get ready to like get through that window when it does open. And that really starts with the work we do now.
That's a great place to wrap us up. I want to thank our panelists. Marika Cox-Mitchell is Vice President for Early Childhood at the Bainham Family Foundation. Elliot Haspel, author of Crawling Behind, America's Childcare Crisis and How to Fix It, and Director of Climate and Young Children at Capita. And Cheryl Oldham, Vice President of Education Policy at the U.S. Chamber of Commerce Foundation. Thanks to all of you for joining the panel, taking time out of your busy schedule. Thanks to all of you for tuning in and taking the time. And thank you, Linda Shockley, for helping us to pull all of this together.
Thanks.
We will be back
Dan.
on Monday, September 11th for the next edition of Early Efforts. We'll be talking about what states are doing to help not only bridge the transition from preschool into kindergarten, but to strengthen their practices in kindergarten itself. So we look forward to seeing you in September. Thanks again, everyone.
Thank you.